This next one, we're going to talk about the profit leak audit with Dave and Lance. Are you both there?
I'm here. Can you see me yet?
There we go.
Wonderful, wonderful. Great. So Dave, you're first on my screen, Peak Physical Therapy in Baltimore. Can you give a little bit of your history as a private practice owner, how you've been involved as a private practice owner? And again, thanks for being here today and doing this.
Oh, no problem. I'm happy to. I've been a private practice owner now for 11 years. And you always start off as that small private practice with all the, just basically all the normal intentions and, self-limiting beliefs that every small private practice has. And it probably took me way longer to kind of get into addressing those. So kind of my route to breakthrough kind of brought me through that. And, being with Breakthrough, I also saw that, hey, a lot of the value of Breakthrough just wasn't always in the presentations. It's in a lot of what you see in the profitability under pressure and other courses. And that's what kind of brought me to be here. How I came to be doing this module is I've seen this in the profitability under pressure course. I saw it, I understood it, and I promptly ignored putting the effort into doing it. And then I went to Orlando. I heard Lance speak. I thought, man, I really should do this. This will be it. And then February hit, and I saw or March hit, and I saw a cash flow reduction. Maybe partly due to changed healthcare, but I wasn't sure. And I was like, we shouldn't be here. So that's when I finally broke down and I did the revenue audit that Chad had suggested. And kind of much like Lance described it, and look on his face when he did it, mine was fairly similar when I kind of all of a sudden realized just how much of the hard work that we're doing, which is kind of just slipping down the drain, and how we were doing things. So then, of course, now I'm gung-ho into it all. So that's what kind of brought me here full circle to where I am here today.
Great. So just for everybody, just to sum that up, we shared a process that I was trying to implement in my own private practice. Lance did it once, and we'll get the full story from Lance. You were in the audience in Orlando. Lance gave you the impetus and the encouragement to go do it. You went back, did it for your practice. And what was that worth to your practice, Dave, just to do that?
Anywhere between 170 on the low end, I figured.
Great. You self-muted at the very end, but you said 170 and then you cut out.
About 170 to 250.
Awesome.
Depending on how you code it. I'm still playing with those numbers now. We added prediction health after the essential part of this. And I'm looking at their numbers even today just to see, okay, where does that number end up?
Awesome. Thanks, Dave. And then Lance, same idea. Where's your practice at in the world? And what are you doing in private practice?
Okay, so I'm in north central Arkansas, rural Arkansas. So we're rural communities all around. I've been in private practice, been in my own business for 26 years, been a PT 28 years, my business for 26 of that as a contract therapist, contracted to multiple things. In our 6th year now of private practice, and we currently have 17 clinics across North Arkansas. So that's 6 years ago, opened our first one-ish, and now we're 17 clinics. And just continuing to ramp up and grow, kind of like Dave's story. Everything was going good, growing, got with Breakthrough in our 3rd year now. Things are ramping up considerably since we joined that. Probably got how much you want me to spend time on that, talk about that with you. Is that what you want to talk about some, I guess?
Yeah, well, I want to start with the profit leak audit. So this is it's a simple process where you go through, you open up your EMR, you go through a day for any clinician, and you look at what's actually happening with the revenue that you're realizing. Can you talk about that, maybe how you delayed doing it a little bit, I think is what you shared, but the story that you shared in Orlando, I think would be great for everybody to hear.
Perfect. So yeah, you introduced the profit leak audit. I thought that's probably a good idea to look at this. So I go back and open the EMR up and start going through it. And it's a tedious process. So everybody understand you do this whole thing. It's a tedious process, but it's well worth it when you're done. You get the data you need from it. But anyway, I started into mine and started realizing that we were actually just leaving money on the table with the amount of units we were billing. So for instance, therapists would document they did 38 minutes and bill for 2 units. So there were just minutes left out there that we weren't billing for. So I did a little deeper dive, and I just pulled back the reins and said, wait, there's no reason to go through this whole audit. I need to do some training with my staff on just how to utilize proper utilization of units, whether it's what payer source or time or whatever you have. So we did that, pulled our whole staff in. So we have 75 clinicians, brought them all in together back in December, had a several hour-long meeting on just how to do your proper billing and coding and things like that. went back and looked a couple months later, and our units had increased a little over half a unit per treatment session.
Nice.
So we did that, and now I looked back again the other day. So 6 months into that, we are still at we're 0.54 units more than we were prior to this teaching. We've had to do a few updated teaching since then, kind of reminders. But what that equates to in my practice with our pay structure, that equates to an increase of $12.53 per visit without seeing an extra patient, without doing extra recruiting. So I'm getting $12 more per patient for doing the same thing we were doing. We're not doing anything extra. We're not seeing patients longer. We're doing the same thing. We're just billing properly, which equates to, in my practice, is going to be a $1.1 million increase in revenue this year for doing nothing different other than coding properly.
Yeah.
So the Profit Audit to me was, I mean, that's priceless almost.
Awesome.
Yes.
Yeah, very, and the numbers get even bigger as we go through the years and everything else.
Yep.
Awesome stuff. So a couple questions for you. One, you're both still treating, correct?
Correct. I did evals this morning.
Yes.
Yes, I got treatments after this. We're done. So, yep.
So how many hours a week do you treat on average, Lance?
Cutting back some. So now I'm about 30 a week. treating.
Okay.
Yep.
30. Dave?
Better. I'm getting to about 20 hours a week.
Okay, great. Fist pound. Great. Okay, so and you have time to work on your business. I think one of something that I'm picking up on is most of us as practice owners, we perceive especially if we're in, we're one, or maybe we only have one other clinician, we're a small practice. How do you find time to work on your business? Can you talk a little bit about that? How you carve out time to do that? And the other thing that I'd love for you to address is most of us, when we actually do that, we end up catching up on discharge notes or emails, or we find time to do things other than focus on the business, to take the time to do an audit, to take the time to work on processes. Can you talk about how you've evolved as a practice owner to work more on your business?
Yeah. Go ahead, Dave.
Yeah, it is the big one, because now I got to really I try to time block myself more, knowing that this period of time I'm going to work on this is something that's revenue oriented. I have to really almost block it that way, knowing that, hey, from 1 to 2 o'clock, I am working on the revenue audit leak. I am looking at the units. I'm teaching the one office now. Okay, this is how we're tracking how many visits do we do per patient per week this week. And on Thursday, I want them to be able to see how many visits is each patient in for next week. So now we can make sure that we're in compliance with our plan of care. And then next week, okay, we're not missing visits. That's new. So I'm really designated time where it's like I'm spending time working on the business in ways that improve the business processes. And I honestly think I get to the point now where it's like I probably lose more money seeing patients that I make by not dedicating more money to these other tasks. So it's been a hard mind shift. I mean, literally, I've been in practice 11 years, and I'm not all the way there yet after 11 years of doing it. But it's really kind of, through some of the things I've done with Breakthrough and other, coaching, I really see the need to kind of make that shift of, when I block my time, does this generate more revenue for the practice when I do this, or am I just doing busy work to avoid my real issues?
Thanks, Dave. Brutal.
Yep.
Brutal truth. Anything to add to that, Lance?
So yeah, so we all do, we set aside time every week. We all do on our list, and then we know the fire comes up or something happens, you got to shift your focus to something else. So I have a hard time with that, because I've set my schedule every week where I'm going to set a certain times to do business things, and then something else comes up. So my time usually is first thing in the morning. I'm an early morning and do it first thing in the morning, do my things, and then go out, and then usually carve some time in the evenings to do some stuff also. Of course, as practice owners, we know we work late in the evening a lot. So evening time. Thankfully, my wife is my partner. She's a PT also. So she does the business management part. I do the field stuff for the business. So her and I together make a pretty good team. So I'm trying harder to be good like Dave, to get around 20 hours a week, or 10 or 0 would be great. 0 treatment hours a week would be wonderful to have time to really work on the business itself. And we're trying to get there. So
yeah, great. Love that. And then I believe this is for you, Lance. Logan asked a question: was your growth in clinics from M&As or organic internal growth? I believe you opened all 17 internally, right?
yes. Yes. So almost. So that's right. So how it started was we were a contract therapy group, and I had about 45, 50 clinicians. We were doing contract home health, hospitals, nursing homes, pediatric, whatever, just contracting. And I got to be in my mid 40s, And I said, wait a second, if all these contracts go away, my business is gone. So I spent 20 years building this business. If the contracts go, I'm out. So I, at a Christmas party dinner, all my PTs, I said, hey, you guys want to open some outpatient clinics? And they were like, yeah, let's do that. So we opened 5 in the first 3 months, just 5 clinics out of the blue. And then him had those around. Then we have to end up with 12. And then we acquired 5 from a local hospital system. They had 5 struggling clinics they couldn't make work, and we acquired those from them just this last year. So that put us to 17. So they're all organic inside except for those last 5. So
nice.
Yep.
Great. So anybody that is on right now, if you have a question for Lance or Dave, feel free to add it in there. The other thing that I want to say is at least what has stood out to me from talking with you both privately or at an event is you both have some discipline, really good growth mindset. You're willing to work on yourself, and you're involving your teams as well. Anything that you want to comment on that in terms of change of thought that you've had as a practice owner?
So I myself do some. I'm not a great reader, you know that. I don't read, but I can listen to some audio things. And I've been tuning in some more leadership things. Like I did some early in my career before I was ever a therapist, really, and got me started tuning back into those. And we're actually doing some leadership training with all of our clinic leaders at the moment. So we're kind of getting into that. We do a weekly meeting with them and doing some leadership parts of that, and then some sub leadership to our marketing crew and our front desk people. So it's really helping a lot. That's changed our culture the last. Not that we had a bad culture at all before, but it's really changed it the last 6 months. Things are really going well. So yeah, and that's been because I've had more time to do it. Before I had no time. Before I was treating 60 hours a week. It felt like. So now I'm cut that in half. I feel like I'm on vacation, honestly, at 30 hours a week. So
you're making everybody jealous. That's great.
Yeah, that's right.
Go ahead, Dave. Follow that one up.
Great. And now it's morning is audio book of books I hear people talk about, what they do, just there. So the morning time is spent on my personal coaching, which is some leadership, some business, anything in that realm. I'll go clinic sometimes in the afternoon, or okay, what do I still like learning clinical things. So I'll do clinical learning, audiobook or reading in my other spare time. I think with the bigger shifts there has been going to, getting that mindset of training the people who are like in the key people in my clinics who are going to be like partners, clinic directors, to manage the numbers more and to look at these numbers. So a lot of my leadership is geared toward, how do you lead people? And then also, how do these numbers matter, and sharing these numbers with them, the profit audit leak numbers, how do we influence our PTs, keeping the emphasis on that they're doing a good job, and keeping the emphasis on here's everything you're doing well. And it's just finding that balance between, not being about feeling like it's about the numbers, but understanding your numbers in a way that, don't feel like it's all we're judging you by. So with this comes, and that's where you need that soft reading skill in the morning, is to develop those traits to know that, hey, I know my end goal is when I look at, okay, what I want them to be with the Blue Cross or Aetna, just by changing a code makes a dramatic difference. How do I get them to want to do that because it's part of their job? So I think it's a lot of work on my part to be a better leader. I think it's all you always have to do in this, or else you it dulls.
Yeah. Just to second what you said there, Dave, love what you talked about with balance. I mean, so many of us are juggling our people skills. We tend to be oriented that way. And then we have the math or the business skills that we need as well. And if they're not in balance, things can get wacky pretty quick and wreck it. So we have a couple of questions that came in. First one, a shout out from Andrew for Lance. Way to go, Lance. You must have great people working for you. It starts with you. Courtney, what is a realistic goal, profit goal for a PT clinic nowadays with all the changes in payment? How do you think about that?
To me, it depends on where you're at. I mean, what location you're at, because I can't even profit for me in Arkansas is way different for somebody in New York City. It's a whole different ballgame. Your rents are different, your wages are different, cost of living is different. It's different. When we go to breakthrough events, we have roundtables, and people ask me, what's my rent? I mean, I've got 5,000 square feet buildings we're paying $1,800 a month for.
Oh,
I know. So I mean, it makes things a little different when you're in Arkansas, in rural Arkansas, doing those things. But our pay scale is different too. I mean, our pay rates are typically higher. We pay our staff more because not everybody wants to come and live in rural Arkansas. So you have to capture them and keep them here for a reason. So
fair.
Yeah.
I'll give a range here. You both can comment on it. So at the low end, we see 10%. If a practice goes to 10%, it's really thin ice. On the upper end, I've seen a couple practices that will hit 25, 27%, but very challenging to go above and beyond that. Is that a safe range for both of your practices, that you're somewhere in there, like a 10 to 25?
Yes.
Great.
Yes.
Okay. Cool. I know Andrew asked a similar question. Danielle, my husband and I also own our own practice, 3 clinics and 21 years in business. How are you handling this new generation that doesn't want to work 40 hours a week? He's still working too many hours to offset these demanding PTs. And I'll preface this. We've had a few interviews this year, probably the roughest batch of interviews that I've ever had, just in terms of, here's my salary expectation. We had one that was $109,000 as a salary expectation. And like what they were willing to do in exchange for that was a little bit of miss. So are you seeing that in your area, whether it's you, Dave, in Maryland, or Lance in Arkansas, and how are you mitigating? How are you thinking through that?
So I'll go ahead. We do see that some. The salary part, everybody wants more money. They all want more money coming out but we pay them well to start with. It's the work ethic part that some of them have. They're not willing to work past 5 o'clock. I'm not going to document in after time. That's their set hours. They come out with these grandiose ideas out of school. But we do something kind of unique, and I've talked a lot about this when I'm at events. Every person that works in an organization is incentive-based paid, from the front desk person to the tech, to the PTA, to the CODA, to the PT, based on volumes. So the busier the clinic is, the more money everybody makes. The slower we are, less money we make. So every single person is on a rising tide in the clinic. For a busy day, everybody's doing good. Slow day, we're not doing so good. So every single person has to get in the game. So, and it works out really well for us, the way we do that model. And everybody's paid the same. Everybody knows. So everybody can look around. If I'm a tech, I'm getting paid the same as that tech over there. If I'm a PT, I'm getting paid the same as that PT over there. So the harder they work, the more they can make. So if you want to work less, you can get paid less, and that's okay. In our groups, we have PTs that are way less productive than others, and they just get paid less than the ones that want to be productive. So it kind of takes care of itself. They all get productive, by the way.
Right.
They do. Yeah.
Dave?
The recent hiring, we've gone to like, okay, we have a base pay, which is actually pretty good. It's probably about 90% of what a normal salary is in our area. And then the rest to kind of match the hospital systems is based on incentive based. So I think we're really moving more and more toward that model of, they have to understand what they have to bring in to reach the salary, that expectation that they want. The salary expectation, I've seen you do this, Chad, is just too out of range. Then it's just a matter of, okay, when can we say, okay, we don't, we love you, but we can't do that. But it's usually matching up with the individual who's probably going to not be the best fit for the culture in the long run when they want something that's a bit unrealistic. Otherwise, they're going to leave you for another dollar somewhere.
Yeah, to kind of tag in what Dave said there, since being around Breakthrough and the events and Chad and the people that talk there, we've changed the way we recruit for sure, and the way we have that initial talk with the expectations for salary, kind of like Dave said. Used to, I would just hire someone and here's your wages, go to work. So now if they want the $120,000 or $110,000, great. You want that, here's what it's going to take to get that. Here's what it has to take for you to make that happen. So they kind of know, if they know going in, they've got an expectation to have when they start what's going to take to get there. And if they're not willing to do that, then they have to settle for less salary or less revenue.
Yeah.
It's been great. I've learned so much from being around you and your groups. So appreciate it.
Yeah, because they want, as they get older, I understand the value of time a bit more. And what they want is that 22 is the same time value that I want out of it. It's like, you don't get both. Those guys are your friends who may be working in banking, they're working, 60, 70 hours a week to make what they're making. They don't understand that, hey, it takes a little bit more than 40 to kind of be where you want to be.
Yeah.
But they went with
Thanks, Dave. Lots of questions in here on incentive-based pay. I'm going to try to sum this up just for time, and then you both can comment on if it's in alignment with what you're doing. Incentive-based pay, where I got it from initially, was outside of PT. It was a company, Jack Stack. wrote a few books on this, Great Game of Business, and another one was called Stake in the Outcome. And he had a service parts business the machine shop that was making parts for International Harvester in the 80s. They lost their contract, basically went away. Lance's fear, which he just talked about, contract went away. So he transitioned his whole company over, and he taught financial literacy to everybody, the whole way from the C-suite down to the janitor and everybody else in between. And pretty much everybody had a stake in the game, stake in the outcome. They were incentivized in some way. We have 110 employees right now. Everybody has some sort of incentive-based program, based plan, right, that they're contributing to, very much in line with what Lance was saying. What we teach at Breakthrough is income. So you take the income or revenue of your clinic, you subtract the cost, you get a profit margin each month or each quarter, and then you take a percentage of that and you dedicate that into like a bonus pool or production pool. Obviously, we all have different employment laws. There's no way that we can make this universal for everybody. Yes, make sure you're in alignment with your Practice Act, huge disclaimer here, and make sure you're compliant with your state employment laws. But basically, you're taking a percentage of your profitability and you're getting it to those that have contributed to the profit. Is that a fair assessment of what you're doing?
Mhm. Yeah. Yeah, I mean, it's different ways. It's, we look at units that they are, hands-on units that they're doing, and then we'll look at total number of visits, which should be a pretty good indicator what they're doing. And with the Profit Audit League, where we're going to go to, it matters which units you're doing. You can't be billing 4 manual therapies and, for every single patient and doing a bunch. That doesn't work either. So we have to interlay that you're meeting a certain kind of billing expectation. And, that prediction helps us see that a little more clear recently.
Awesome. Thanks, Dave. Lance, anything there?
Yep. So we do similar to you with a profit, usually every quarter, show what profit there was, and we're very transparent with everybody. We show them the whole profit loss statement. We don't show people's wages to each other, but we show up, here's what the clinic did, and we give everybody bonuses on that. And then our day-to-day wages are not incentive based, but volume based. So for instance, our front desk people, they're paid an hourly wage, plus they get an extra bonus for every patient that walks in the door. So that every patient that walks in the door, they get a small percentage of that patient, everybody's, because they're the ones that get them coming back. They got to schedule them, they got to keep them coming back. So they have reasoned them to be nice to our patients, basically. So to make sure the schedule stays full. And so they're all in the same. So everybody in the clinic gets that.
So
And therapists are kind of like Dave's. They're paid a base rate and then a per unit incentive, per unit that they bill incentive for that. So, yep.
Great. Awesome. Again, disclaimer for everybody here. Make sure you talk with an employment attorney in your state that's familiar with your state employment laws, and then, and you're compliant with your Practice Act as well. Great. So one more question for you both. I don't see any other questions. Oh, actually, here's a good one from Ashley. Do you still give them raises on base or create more ability to make more on the incentive-based yearly? Great question. So how do you think about raises juggled with a production bonus?
So our ancillary staff, office staff, front desk, think they get a raise to a certain point and they cap at a certain dollar rate. That they don't go past that, and then their bonuses are based on the volumes of the clinic. So, and they know that coming in when they're hired. Here's your raises, going to go standard raises to a certain point, and they stop at a certain point. 2 years in, raises stop, and it's solely incentive based after that, as far as visit goes. Therapists are hired at a rate first day, and they stay at that same rate their whole career with us. The only way they make more money is being more productive, or the clinic bonuses. So as the clinic gets busier and the clinic is more profitable, there's profit bonuses that go out every quarter to them. Our PTs do really good. Like, they do really well. Our average across the board is, I would say, our PTs are 140K a year, probably.
Wow.
Our bonuses and stuff. Yep. So
moving to Arkansas, Dave.
right. That's what everybody always says when they say that. Oh, moving to Arkansas. Well, yeah. If you want to,
I'll pick you up on the way, Chad.
right. Yeah.
Great. Anything to add to that, Dave?
Yeah, there is a bit of a cap on the staff employee that's there. I think we heard say they're not maybe we'll make it basic where we are here, and the rest is just profitability. they're going to have the ability to open a clinic or add additional value to us that brings in additional revenue, and we'll rethink their structure.
Yeah.
You know, for instance, you know, you're a public health therapist, you came on and she fills her schedule, she fills a PTA schedule, and it's funny enough, she brought in some cardiopulmonary.
All right, Dave, I think we officially lost you there. That's all right. So one more question here from Samir. This will be for you, Lance. How far in the future do you plan for? So let's call it like a financial plan, and do you have a roadmap for your business? Tough question.
Yeah. So I think you and I have talked about this some, Chad. I just kind of, I don't know. Tomorrow's the game plan, I guess. I just really know I don't have a long-term game plan out there. There's no roadmap. Things happen in our business organically, kind of. They just spawn up. So most of our 12 of our 17 clinics came from somebody in our practice said, I want to have my own clinic manager. I live in this town. Can we have a clinic in this town? We assess them, kind of like you do. Great. Look like the VA manager. Let's open a clinic here. Is it feasible? And we did that. And that's how we're progressing now. We're on track to probably open 5 or 6 more clinics in the next calendar year. And it's all going to come from people in our organization stemming off wanting to have their own place. So when we bring a new grad on or a new PT on, they come on with the expectation that if things work out here, I'm going to have my own clinic someday under the GTS headhold. So that's our plan, I guess. We don't have really a great roadmap. It just kind of goes here and it just kind of goes like this, I guess. Whichever way leads us to the end, we're going to take it. Did I answer the question? Not really, I'm sure, but
Yeah, you have an idea of where the practice is going, but yet you're flexible enough based on
yeah,
where
right.
you're at with the team.
Our whole organization is built around the staff. That's what it's built around. It's not built around having another clinic. It's built around our staff. So if our staff is happy and want to do things, we're going to do that. And that's pretty much how I do everything. If they come to me with an idea, sounds feasible, I mull it over for a while, and I usually take too long to make a decision, you know, and then we do that if it's gonna work out. So that's how we approach things. Our growth is just happens.
Yeah, great. How about some love, everybody here for Lance and Dave in the chat? That'd be awesome. Thank you both for doing this. This is great.
Not a problem. Anytime. Thanks, Chad. See you soon.
No, thanks. My pleasure.
Thanks, guys.